Hello dear friends. So we have this question on large bowel obstruction. So basically large bowel obstruction is of two type. One is mechanical and second one is functional. The mechanical one is dynamic obstruction and the functional one is adynamic or pseudo obstruction. Then most common cause of obstruction, mechanical obstruction in US, it is colorectal carcinoma. Whereas volvulus is seen in Russia, in Eastern Europe, in India, in Middle East, and in Africa. One third of the cases of large bowel obstruction worldwide, they are because of volvulus, colonic volvulus, and most common site is sigmoid. Now, this mechanical obstruction, it presents as increased peristalsis, increased bowel sound hurt, and colicky pain, low grade colicky pain. When it lasts long, there will be absent or decreased bowel sound. There will be failure to pass stools and flatus, and there will be increased abdominal distension. Now, we have this acute obstruction and progressive obstruction. This acute obstruction is basically a dramatic thing in which there is rapidly increase the size of the abdomen, there is distension and there is pain, there is obstipation, non-passage of stool and flatus, and there is tenderness. Whereas in case of progressive obstruction, there will be increased constipation and patient will pass pencil like stool, which eventually over the period of time there will be complete obstruction as well, and there will be intermittent pain. Whereas in case of functional obstruction, there will be distension, there is vague abdominal pain, and there is weak or absent bowel sound. Then there is one more term which is closed loop obstruction. This closed loop obstruction, this is mainly seen with volvulus and the sigmoid volvulus and strangulated hernia. Whereas this can also be seen with one more condition whenever there is ileocecal valve competence. Because whenever there is ileocecal valve competence and there is a tumor distal to ileocecal valve on large intestine, there will be obstruction on both ways. Because if this ileocecal valve will be competent, the content will not be able to pass into small intestine, and there will be distension, marked distension, which eventually will lead to necrosis and perforation of the large bowel, which is a, if you see this x-ray, this x-ray, you will find here coffee bean sign, and this is characteristic of sigmoid volvulus. This is coffee bean sign, and the CT film, you are able to see a marked area. This area, this is marking the twisting of the mesentery in sigmoid volvulus, and this is known as mesenteric whorl sign. Mesenteric whorl sign. This carcinoma colon, if it is left side, there will be more chances of obstruction because this will be circumferential. Whereas on right side, there are more intense chances of anemia in this patient, as it is polyploid in nature. The tumor is polyploid and not circumferential. So coming to the question, so the following statement regarding large bowel obstruction are true except first is closed loop obstruction can be seen in absence of colonic volvulus or strangulated hernia. This is true because this can be seen with competent ileocecal valve as well. In USA, most common cause is colorectal carcinoma. True, colonic volvulus include more than half of the cases of large bowel obstruction. This is false, as volvulus include one third of the cases of large bowel obstruction worldwide. Then volvulus more common in Africa, Asia, and India. This is again true. It was more common in Africa, Asia, India, Middle East, and Eastern Europe.